Hi, welcome to Child Medics. I am Dr. Aditi Goimawala, a child specialist from Mumbai. Today, let's talk about diaper rash. Diaper rash is one of the most common problems of young infants and toddlers, causing them discomfort and mothers a lot of grief. So, what is diaper rash? Diaper rash, which is also known as diaper dermatitis, is a rash or irritation anywhere in the diaper area which makes the skin sore, red and tender. So, the most common types of rashes are irritant contact dermatitis, candidal dermatitis, atopic dermatitis, seborrheic dermatitis, intertricho and bullous impetigo. We'll be looking mostly at irritant diaper dermatitis as it is the most common type of rash. The course of diaper dermatitis is typically episodic. Each episode of mild to moderate diaper dermatitis is treated with conventional therapies, has an average duration of 2 to 3 days. Diaper dermatitis that persists for more than 3 days despite standard treatment or if left untreated may be secondarily infected with candida. Who all are susceptible? So babies and toddlers in diapers or children taking antibiotics are particularly vulnerable to yeast or fungal infections. So, how do we know if the child has diaper dermatitis? What are the signs and symptoms? There will be rash and bumps on the baby's bottoms and thighs. There will be scaling, there will be bleeding. In boys, a diaper rash may appear as a sore at the end of the penis. Dryness, spots or blisters or peeling of skin in the diaper area. There can be a slight temperature rise due to inflammation or the child can be really fussy. Will it spread to other babies? Irritant diaper dermatitis or simple diaper rash is not contagious. Diaper rash that is caused by microorganisms can sometimes spread to other parts of the body if the conditions are favorable. For example, yeast infections which thrive on moisture and warmth can take hold of the skin that is already irritated. When conditions are right and precautions aren't taken, such infections may also spread to other children. So, what causes diaper dermatitis? Diaper dermatitis can be caused due to a variety of reasons. A few of them are prolonged contact with feces is the most irritant toxic factor on the skin. Second, excessive moisture retention in the diaper region. Tight diapers. It causes sweating and increases the pH of the baby's skin, making it more susceptible to rash. Friction with the diaper can also make the situation worse. Chemical sensitivity. If the baby's skin is sensitive to the fragrances used in disposable diapers, it can cause rash. Sometimes, chemicals present in the baby's skincare products can also cause rash. New foods. Some foods can increase the frequency of bowel movements as well as the pH of the poop causing rash. Yeast or bacterial infection. The skin under the diaper is warm and moist and acts as a perfect environment for bacteria and yeast to thrive. They can cause rash on sensitive skin. Antibiotics. They sometimes kill the healthy bacteria and fight the harmful ones, leading to yeast infection and further rashes. Allergy. Possible sensitizers include rubber, detergents, preservatives, etc. So, how do we treat diaper rash? Treatment of diaper rash includes a combination of measures which are most effective when used together. They are diaper-free periods. The most effective way to treat irritant diaper rash is to reduce skin contact with urine and feces. That is, by discontinuing or limiting the use of diapers. One way to do so is to allow the child to periodically go without a diaper, allowing the skin to be exposed directly to the air. The diaper area should be cleaned gently with warm water and a small amount of mild cleansing product with physiological pH. As an alternative, fragrance-free or alcohol-free baby wipes can be used. But use should be discontinued if the skin becomes irritated or broken. When the child wears a diaper, frequent diaper changes are recommended. A suggested interval might be 2 to 3 hours or immediately after every bowel movement. You can also use skin barrier ointments or paste to prevent or treat irritant diaper rash. The ointment or paste should be applied at every diaper change and can be covered with a thin layer of petroleum jelly to prevent sticking to the diaper. The ointment or paste should be long lasting and should stick to the irritated or broken areas of skin. It is not necessary to clean the ointment or paste off the skin at every diaper change. Lotions and creams are not as effective as ointments or pastes and are not recommended. In addition, products that contain preservatives, fragrances, and other additives are also not recommended because they may further irritate the skin. Most diaper products contain ingredients such as zinc oxide and petroleum, which form a protective skin barrier against wetness. Some also contain lanolin, paraffin, or dimethicone. A few barrier creams which we commonly use in the OPDs will now appear on your screen along with their prices. You can also use coconut oil or Vaseline. Antifungal treatments. Antifungal cream will be prescribed to the child if the child is diagnosed with a yeast infection. This type of treatment is not recommended without consulting the child's doctor. Antifungal treatments are available as cream, ointments or powders. The treatment is usually applied 2 or 3 times per day and can be applied beneath the barrier skin ointment or paste until the rash is gone. Sometimes, steroid ointments may be prescribed in severely inflamed skin. Please do not use them without your doctor's prescription as they can be really harmful. Antibiotics. If the child develops signs and symptoms of a skin infection, a healthcare provider should evaluate the child. If needed, he or she may prescribe an antibiotic ointment or oral antibiotic. Over-the-counter antibiotic creams or ointments are not recommended because they contain ingredients such as neomycin or Paediatricians to which many children are allergic. They always say prevention is better than cure. How do we prevent diaper rash? It is possible to reduce the risk of developing diaper rash by following some basic hygiene suggestions. It is not clear whether cloth or disposable diapers are superior in preventing diaper rash. With either choice, changing the diaper frequently can reduce contact between the skin and urine or feces. During an episode of diaper rash, disposable diapers are recommended because they are highly absorbent and specifically designed to minimize skin exposure to wetness. If cloth diapers are used, cloth diapers should be washed in hot water and mild detergent. Cleanse the skin in the diaper area gently and carefully. Overzealous cleansing can cause or worsen irritation and delay skin healing. Gentle cleansing with warm water and a soft cloth is usually sufficient. If soap is desired, a mild, fragrance-free product is recommended. If baby wipes are used, choose a brand that is alcohol and fragrance-free. Baby wipes are not recommended if the skin becomes irritated or develops open sores. If a diaper rash does not seem to be improving, baby wipes should potentially be stopped as some baby wipes can cause allergic skin reactions. Skin that is peeling or broken can be cleansed using a washcloth soaked in warm water and squeezed out onto the skin. To avoid unnecessary friction, the skin should be patted dry with a soft towel. Usually, with these methods, diaper rash gets treated in 2 or 3 days. There are a few danger signs which need to be taken into consideration. Please take your child to the pediatrician if any of these signs are present. The rash that's appearing on other body parts, it is not improved in more than 3 days. Pus formation along with the rashes. Your baby has a fever accompanied with the rash. Redness in the area intensifies or worsens. Visible open sores or yellow patches. Baby is less than 6 weeks old. Or the rash is accompanied by continuous diarrhea for more than 2 days. So there are a few homemade remedies you can try. First is coconut oil. Massage diaper area with coconut oil to get rid of the rash. It has antimicrobial and antifungal properties. After cleaning and drying the buttocks, apply half a spoon of coconut oil over the affected area. A warm bath, it will soothe the itching and burning. Soak your baby's bottom in a tub of warm water once a day. You can also use breast milk. Breast milk helps to soothe and heal the baby's skin. Its natural anti-infection properties heals the baby fast. Express a few milliliters of milk and apply a thin layer on the rash and allow it to dry. Make the baby wear a fresh diaper. Else, you can also apply aloe vera. Both fresh gel as well as bottled aloe vera can be used. Apply a thin layer on the affected area and leave it dry. There are a few things that you should completely avoid while dealing with diaper dermatitis. Use of powders such as cornstarch or talcum powder pose a significant respiratory risk if accidentally aspirated and therefore should be avoided. Baking soda and boric acid powders should also be avoided because of the risk of systemic toxicity with percutaneous absorption. Topical barriers or medications that contain fragrances, preservatives and other ingredients with irritant or allergic potential, for example neomycin, should be avoided. Products containing boric acid, camphor, phenols, benzocaine and salicylates should be avoided because of the potential risk for systemic toxicity. That's it for today. Hope you liked our video. Please like, share and subscribe. Thank you.